How to use a first aid kit. What your first aid course didn't teach you. Brought to you by FirstAidMark.com and American CPR Training. Having a first aid kit is an important part of being prepared for any emergency situation. Keep a first aid kit easily accessible and fully stocked, and remember to replace used and outdated contents regularly. Hi, my name is Nick Ronanelli, and I'm here to show you how to use some of the standard contents of a first aid kit. A first aid kit should contain a chemical cold pack, scissors, adhesive tape, disposable gloves, antiseptic wipes, triangular bandages, roller bandages, sterile gauze pads, adhesive bandages, pain relief tablets, antibiotic ointments, tongue depressor, abdominal pad, eye pad, latex-free elastic wrap, and tweezers. You should also have first aid guides for reference. And some first aid kits include a breathing barrier in case resuscitation is needed. Protective equipment. We have two types of gloves, nitrile and vinyl. There's also latex gloves, however, we don't recommend latex due to allergies. Gloves are an essential part of any first aid kit. Use gloves whenever possible while performing first aid. Gloves help to keep a barrier between you and potentially infectious bodily fluids. Use a biohazard bag for any contaminated materials. For broken glass or for needles, a sharps disposal container should be used. Contact your local health authority to learn how to properly dispose of these materials. CPR breathing barriers are used to protect the rescuer when giving rescue breaths. It will help prevent blood, saliva, or vomit from getting into the rescuer's mouth. As you can see, we have a wide variety of breathing barriers, and here's how they're used. A pocket mask is 90% more effective than mouth-to-mouth. To use it, simply place the mask over the person's nose and mouth, ensure you have a tight seal, open their airway, and ventilate. Each breath should last 1 second. For a baby or a child, you can still use a pocket mask. Simply invert the pocket mask so that the point of the barrier is toward their chin, secure, and ventilate. Some types of disposable barriers come complete with non-latex gloves, antiseptic wipes, and the breathing barrier. To use a disposable breathing barrier, simply take the mouthpiece and place it inside the person's mouth. Peel back the plastic, tilt their head back, and then ventilate. Minor cuts and scrapes. For minor cuts and scrapes, follow these first aid steps. Clean, treat, cover, and protect. In the case of minor cuts and scrapes, the first step is to disinfect the area using antiseptics. Here are some types of cleansing wipes that contain benzalkonium chloride, also known as BZK. Hand sanitizer is critical for disinfecting the rescuer before first aid is given. Castile soap towelettes are a gentle and effective product for cleaning wounds. Alcohol wipes are essential for disinfection and sterilization in first aid care. Povidone iodine is a classic example of an effective antiseptic. You can find povidone iodine in swabs, solution, or swab sticks. Antiseptic sprays are ideal for sanitizing large or small wounds rapidly and easily. Antiseptic sprays are available in both aerosol and pump bottles. Apply an antibiotic cream if the person has no allergy to it. Antibiotics are used for treating cleansed injuries before applying bandages and covering in first aid. Antibiotic ointments come in brand name, single antibiotic, and triple antibiotic varieties. There are a wide variety of adhesive bandages. For smaller wounds, use a simple adhesive bandage that can come in all different shapes and sizes. Adhesive bandages come in plastic, woven, and in a variety of sizes. And be sure to choose latex-free. Specialty bandages include elbow and knee, junior, and blue bandages for restaurant and food service. These are easily seen if lost during food preparation. Specialty adhesive bandages include fingertip, knuckle, and a combination pack. The knuckle bandage is shaped like the letter H. A knuckle bandage is placed over the top of the knuckle to treat a typical knuckle cut or scrape. The 4 adhesive strips are wrapped around the finger above and below the knuckle. This allows the joint to bend without interfering with the bandage's position. To properly apply a fingertip bandage, first stick one end of the bandage to the finger, then pull it over the fingernail and secure the flaps in place. There are also bandages especially designed for specific uses, such as larger body parts. Spray bandage products are an effective solution for bleeding control and protection for smaller cuts or larger abrasions. 2 of the most important items in any first aid kit are gauze pads and gauze rolls. Be sure your first aid kit has a variety of different types and sizes. Square gauze pads come in different sizes, so use the appropriate size to cover a wound. Use a gauze roller bandage to secure the dressing in place. You can even use first aid tape to secure all 4 sides of a square gauze pad. There are a wide variety of first aid tapes, each designed for certain purposes. These are latex-free elastic adhesive tapes, ideal for securing bandages and binding wounds. Basic first aid tape is found in almost any first aid kit or cabinet. It can stick easily and can be torn without scissors. These are latex-free, waterproof tape ideal for securing bandages that you might get wet. What's cool about Tri-Cut tape is that it's cut in 3 different sizes. Cloth athletic tape or sports tape is used for binding joints such as wrapping an ankle and can be used for attaching sports safety equipment like shin guards. Use first aid scissors to cut tape or bandages at an appropriate length. Here are some examples of different first aid scissors and shears. These scissors are designed to protect the skin while removing clothing or cutting bandages, wraps, or tapes. Impaled object. For minor impaled objects like a splinter, use tweezers to help remove the object. You can use specific products like Splinter Out. It's better than a needle because it's sterile and has a point that is designed for loosening and pulling out splinters. There are a variety of tweezers to choose from. Some even come with a magnifying glass. Major external bleeding. Major bleeding can be life-threatening as it reduces the blood flow to the vital organs and can result in death. Severe injuries require special consideration. These products are designed to stem heavy blood loss. Direct pressure to the area to control the bleeding. If bandage becomes blood-soaked, do not remove it and simply add another dressing in place. Here we have an abdominal pad, we have trauma dressings, we have the blood stopper, and my favorite is a pressure bandage, which is a dressing and a bandage all in one. Extensive internal or external bleeding can cause the person to go into shock. The loss of blood leads to low blood volume and decreased oxygen supply to the vital organs. Elevate the legs above the level of the heart. Cover the person with a solar or emergency blanket to maintain normal body temperature. An emergency blanket can reflect back 90% of the body's heat. Closed wounds. In the case of a minor closed wound, cold can help control both pain and swelling. Our instant cold compress temporarily relieves minor pain and swelling from bumps, bruises, sprains, aches, and sore joints. It is conveniently disposable with no pre-chilling required for quick, effective relief. To use an instant cold pack, first shake, squeeze to break the inner bag, shake to mix, and apply. No barrier between the instant cold pack and skin is needed. Cold can also be used to treat a bone, muscle, or joint injury. To review how to use an instant cold pack, simply shake, squeeze to break the inner bag so the contents can mix, and apply. The elastic ice securing wrap is ideal for holding ice or hot or cold compresses in place over an injury.
Apply a cold compress for 15 minutes every hour. Immobilize the injured body part to prevent further damage.
There are a variety of splinting products that are designed to immobilize specific body parts. Triangular bandages are commonly found in first aid kits and can be used to provide immobilization and support to an upper body injury. Slings.
For upper body injuries, you can apply a sling. Place a triangular bandage underneath the injured arm. The top point of the triangle should be towards the injured elbow. Wrap bandage securely to support the injured body part. Tie both ends of the bandage behind the neck. Twist or pin excess bandage around the elbow. Make sure the sling covers the entire arm with fingers slightly exposed. For extra support, secure a broad transport bandage to stabilize the sling.
A latex-free elastic wrap is another product used to provide immobilization and support. Wrap the bandage from below the injury, working upwards while maintaining tension throughout. Use the clips provided to pin the bandage in place. This is called a SAM splint. It's a type of rigid splint. Here's what it looks like, and it can be used to splint different body parts. Here are some examples. A SAM splint is a pliable splint that can be shaped to the contours of injured limbs. For an arm injury, simply place the splint under the arm and secure the arm in place by using tape or any other bandages. You can even splint the arm from the top and bottom and secure in place. For a leg injury, place the bandages under the leg. Apply the splint on both sides of the leg. Bandage the splint in place. Cross the ankle, go under the foot, and tie on top. Emergency air splints are highly portable and easy to use. For an arm injury, simply slide the air splint over the injured body part. Pull the air valve to inflate. When secure, push the air valve closed to seal. Use the same steps for the leg splint. There are also splints designed for smaller body parts, such as fingers. Most finger splints are used by placing the splint under the finger and bandage in place. There is also a finger splint that you can use to cover the top and bottom of the finger, and bandage as usual. Eye injury. Place the casualty on their back. Do not attempt to remove the object. Place sterile dressings around the object to help support the object in place. Secure the dressing with a bandage. If there is a foreign body, such as sand, dust, or chemicals in the eye, flush the eye with water. If the object is chemical, flush continuously until EMS arrives. If flushing one eye only, position the affected eye downward so that the foreign object does not come into contact with the other eye. If the object cannot be removed, cover both eyes to discourage any eye movement and transport the person to the hospital. Here is a variety of eye wash products, each designed for a different purpose. Our eye wash relieves irritation, burning, and discomfort by removing loose foreign material. Here we have a wall-mounted dual eye wash station. Our eye care pack includes sterile eye pads, eye wash, and first aid tape. Together, they provide cleansing and a sterile covering for eye injuries. A Haws eye wash station is portable and gravity operated. It provides flushing for a full 15 minutes. Burns. A first-degree burn damages only the top layer of skin and can be painful and may swell. A second-degree burn damages both layers of the skin. The burned skin is red and has blisters that may be open and leaking fluid. Scarring may occur. A third-degree burn destroys both layers of the skin as well as nerves, blood vessels, fat, muscle, and bone. The skin may be charred black or even white. Cool the burn with water for at least 15 minutes until the pain stops. Once you've cooled the burn, apply a burn cream to relieve pain and prevent infection. To further protect the area, cover the burn with a dry, non-stick sterile dressing. Burns are one of the most serious types of injuries. Therefore, we have a vast selection of burn treatment products. Now we will take a moment to show you their purpose. First aid burn creams incorporate both antiseptic and healing properties in a single product. Burn kits contain the basic necessities for specific burn care emergencies. Our kits include burn dressing, first aid tape and sterile gauze rolls, exam quality gloves, and nickel-plated scissors. Heat shields and fire blankets are wrapped around a burn victim. They are used to stop the burn progression, ease the pain, and protect against airborne contamination. The American Red Cross Burn Emergency Responder Packs include essential supplies to treat and protect minor burns. Its lightweight design makes it easy to grab, pack, and carry. Our burn spray and burn pump spray with aloe vera work to relieve the pain of minor burns, abrasions, scalds, even sunburns, while also disinfecting the area. Burn gels are used to soothe and cool minor burns. Gels form a protective sterile layer while moisturizing the skin for fast pain relief. Sterile burn dressings come in various sizes and help to prevent burn progression without using water. A burn dressing protects from contamination while it cools, comforts, and relieves pain. Hypothermia. Hypothermia is caused by exposure to the cold to the degree that the body cannot keep itself warm. In hypothermia, body temperature drops below 35 degrees Celsius or 95 degrees Fahrenheit. As the person gets colder, the heart begins to beat irregularly and eventually stops. Change the person's clothing only if necessary and have them sit near a heat source, like a fireplace or a stove. Give warm liquids if the person is alert, preferably non-alcoholic and decaffeinated drinks. Wrap the person in blankets or heat pads. Do not warm too quickly as it can cause heart problems. Frostbite. Depending on the circumstances and time of exposure, frostbite may occur by itself or along with hypothermia. Frostbite can occur in body parts that are exposed to extreme cold. The water in the skin freezes and swells, causing cells to die. Deep frostbite can lead to the loss of body parts. Gradually warm the body part by gently immersing the affected area in warm water until it appears and feels normal. Place gauze or cotton between the fingers and toes. Bandage the area with dry, sterile dressings. And see a doctor. Ideal for cold weather activities, our Sports Heat Body Warmer provides safe and instant heat in convenient, air-activated packages that fit easily into pockets, liners, and wraps. The Ready Wash self-heating washcloths feature a self-warming system that allows the washcloths to heat without the need of a heat source. The super soft cloths are hypoallergenic, latex, and alcohol-free.
In this scenario, the casualty has wounded their thumb using a knife to cut up an apple. An injury with a knife in this manner will usually be a clean cut, an incised wound. As the first aider, I was nearby on this occasion and heard his pain. However, as always, you should check for any obvious danger using all of your senses before approaching the casualty and gaining a response. You will see in this scenario that the casualty is in pain, but in full communication with me. The only risk is that they may faint from the sight of blood or psychological shock, or suffer medical shock from the loss of blood. Avoid touching the wound until you have your gloves on, but take a look for foreign or embedded objects. In this scenario, as suspected, nothing is embedded. Whilst we shout for help and ask for a first aid box, we can ask the casualty to manage their own bleed, as they cannot cross-contaminate themselves. Remember, the primary treatment of bleeding is pressure and elevation. Then, with your gloves on, treat the bleed. Once the flow of blood has stopped, dress the wound using an appropriate size dressing from your first aid box and keep it elevated at all times.
Choking is a life-threatening situation and happens when the casualty's airway suddenly gets blocked so that they cannot breathe normally. Usually, choking in small children is caused by a small foreign object, whereas in adults it is most commonly food. If the blockage of the airway is mild, the casualty should be able to clear it by coughing. Any blockage of the airway should be taken very seriously, as within a short time of the brain being starved of oxygen, brain damage can occur. The recognition, signs and symptoms. Grasping of the throat, anxious and distressed, difficulty in speaking and breathing, persistent cough, pale grey-blue skin developing, becoming unconscious. Let's now look at the treatment.
Once you have established the casualty is in fact choking, your first action should be to calm and reassure the casualty and encourage them to cough. If this is not successful, then you should stand behind the casualty, leading them slightly forward, supporting their upper chest with either one hand or your arm across their chest, and give sharp back blows between their shoulder blades. These back blows should be attempted on 5 occasions. Check the mouth and remove any obstruction. If your back blows were unsuccessful, then you should attempt to give 5 abdominal thrusts. Again, stand behind the casualty and place both arms around them, leaning the casualty forward. Place one fist just below the breastbone and cup the fist with the other hand, as shown on the video. Then pull sharply inwards and upwards to try and force the obstruction out. Again, you should make 5 attempts with abdominal thrusts to remove the obstruction. If this is unsuccessful, you should repeat the cycle of back blows and abdominal thrusts. And if after 3 cycles the obstruction is not cleared, you should then call 999. If at any time the casualty becomes unresponsive and unconscious, you should support the casualty to the floor, call the emergency services as soon as possible, and commence basic life support.
So, in summary, encourage to cough up the obstruction first. Calm your casualty. Likely to become weak and lose consciousness within a few minutes. Make your movements sharp and firm. If not successful, with 3 cycles, dial 999.
With a choking baby, you should hold the baby in a similar position as a recovery position by supporting the baby with their head pointing downwards. As with an adult or child, you should first attempt 5 back blows. If this is not successful, turn the baby over and attempt 5 chest thrusts. If this is also unsuccessful, you should repeat the cycle of 5 back blows and 5 chest thrusts. And once again, if the object or obstruction has not become clear after 3 cycles, then call the emergency services.
A heart attack is most commonly caused by a sudden obstruction of the oxygenated blood supply to part of the heart muscle, such as when there is a blockage in one of the coronary arteries. If the heart does not receive oxygenated blood, part of the heart muscle will die and impact on its ability to function properly. There is real risk that the heart will stop beating. The severity of the attack will depend on where the blockage occurs. Many people who die after having a heart attack could be saved if someone recognised the early warning signs and called for professional help as soon as possible. The recognition, signs and symptoms. Central vice-like chest pain. Possible pain down left arm or in jaw. Breathlessness. A rapid or irregular pulse. Rapid breathing and a shortness of breath. Pale blue-grey cold and clammy skin. Nausea and vomiting. Sense of doom. Let's now look at the treatment.
As you come to the initial assistance of your casualty, you should assist the casualty to rest and reduce the pressure on the heart. The ideal position for a casualty suffering from a heart attack is known as the half-sitting position or the W position. You should support the casualty to the floor, bend their knees and support their head and back. If available, place something underneath their knees to support them in this W position. You should monitor the casualty's airway and breathing at all times and loosen any clothing. Calm and reassure the casualty and call 999 for an ambulance as soon as possible. If the casualty becomes unresponsive and unconscious and is not breathing normally, then you should carry out basic life support procedures.
So, in summary, often confused with indigestion, but never again. Take action as every minute counts. Reduce pressure on the heart. Dial 999. Be prepared to provide basic life support. You can administer aspirin if you are sure your casualty is not allergic. Any doubt, do not administer. Shock is a life-threatening condition and occurs when the blood flow to vital organs is critically reduced and deprives the organ of oxygen. It is simply described as the lack of oxygenated blood to the body's vital organs. Major causes of shock include heart attack, severe blood loss from uncontrolled internal or external bleeding, and also conditions known as dehydration, severe infection, poisons, persistent vomiting and diarrhea. The recognition, signs and symptoms. A rapid, weak pulse. Pale, blue-grey, cold, clammy skin. Nausea and thirst. Rapid, shallow breathing. Unconsciousness. Let's now look at the treatment.
First of all, it is important to treat the cause, whether that is a bleed, a burn or an injury. If the injuries allow, lay the casualty down and then raise and support their legs. This action will help keep the blood at the body's vital organs. Be aware of injuries such as a spinal injury or an injury to the legs. So if, for example, a casualty has a fracture to one leg, then to treat for medical shock, you should raise simply the other leg. You should loosen tight clothing and keep the casualty warm with items such as blankets or coats, but ensure that you insulate any cold ground. Call 999, calm and reassure your casualty, whilst monitoring the airway and breathing at all times. If the casualty becomes unresponsive and unconscious and is not breathing normally, then you should carry out the procedure for basic life support.
So, in summary, shock is life-threatening. Don't forget to treat for shock when managing more obvious injuries. Lay the casualty down and raise their legs if injuries allow. Dial 999. When a person with asthma comes into contact with something that irritates their airways, an asthma trigger, the muscles around the walls of the airways tighten so that the airways become narrower and the lining of the airways becomes inflamed and starts to swell. Sometimes sticky mucus or phlegm builds up, which can further narrow the airways. Common triggers include house dust mites, animal fur, pollen, tobacco smoke, cold air and chest infections. The recognition, signs and symptoms. Shortness of breath, coughing, difficulty breathing out, wheezing, distress and anxiety, difficulty in speaking, grey-blue skin tones, may become exhausted. Let's now look at the treatment.
Asthma is a very serious medical condition and immediate action is required. Firstly, help your casualty into a comfortable position and, if possible, a sitting position. This is leaning slightly forward, taking pressure off the chest wall. Then calm and reassure your casualty. The most important consideration with an asthma attack is to encourage the casualty to use their own prescribed medication. This is usually in the format of a reliever inhaler. The blue inhaler is the most common colour for the reliever medication. However, the casualty may have other medication and this may be in a different colour. The casualty is usually able to direct you with hand signals towards their inhaler because speaking will be difficult. If the reliever medication has no effect, or if the attack lasts more than 5 minutes, or in fact it is the casualty's first attack, then you should call 999 for an ambulance.
So, in summary, very distressing for all. You may feel very helpless. Sit your casualty up, leaning slightly forward. Use of their own medication, usually a reliever inhaler. Calm and reassure.
For more information on CPR and first aid procedures, check out our comprehensive, full-length DVD series on first aid and CPR. Thank you for watching. We hope you enjoyed our presentation. Please remember that this information is not a substitute for live training, and it is highly recommended that you contact American CPR Training for first aid and CPR courses in your area. The preceding presentation was brought to you by firstaidmart.com. Guess what we sell? A lot more than first aid. First aid kits, CPR supply, emergency and safety equipment for all your needs. Shop online or please call toll-free at 1-888-6-BANDAGE. And American CPR Training, offering the most entertaining, affordable, accurate, time and cost-efficient CPR, first aid, AED, and other safety training classes in the US, Canada, and Mexico. America's favorite CPR, AED, and first aid training. Half the time, half the price, and twice the fun.